Yesterday, the death toll from COVID-19 in the U.S. was more than 3,000. That is the highest for a single day since the start of the pandemic, and eclipses the casualties from the 9/11 terrorist attacks. The total official death toll is also expected to surpass 300,000 this weekend. Today, the FDA advisory panel is expected to meet to discuss whether to recommend emergency use authorization of the Pfizer vaccine, which has already been approved in Canada and the UK. Our Nikki Battiste reports from Mount Sinai Hospital in New York City.
We'll be setting this up in a more robust and permanent way.
As early as the start of next week, Mount Sinai Hospital hopes to be able to administer up to 50 COVID vaccines every hour. Susan Mashney is the Vice President and Chief Pharmacy Officer for the Mount Sinai Health System.
With 40,000 employees, you need about 80,000 doses. How many vaccines do you expect in this first round?
So it's everybody's best guess. We hope to get in the thousands.
She says frontline workers in the ER and ICU will receive the first doses.
Well, folks like the nurses and the physicians, as well as people like the environmental service workers, the workers that provide food service, the transportation workers.
Once the emergency use authorization is approved, it's expected UPS will deliver the delicate vials to the eastern part of the country, while FedEx tackles the west. After the shippers pick up special cold boxes containing the vaccine from Pfizer, they'll drive to their nearest facility before flying to a distribution hub. UPS has constructed an ultra-low temperature freezer farm at its hub in Louisville. The company's command center will closely track the location and temperature of the shipments. In the UK, where vaccinations began this week, the government is now warning people who have severe allergies not to take the shots. The move comes after two healthcare workers who carry adrenaline shots for their allergies suffered reactions. They're recovering well. Now, U.S. officials are urging caution, saying those with severe allergies should not get the vaccine. Back at Mount Sinai, Mashney says once a dose is pulled from the freezer, it must be used within 6 hours.
Time is everything.
It is timing and time. So making certain we get people scheduled and get it going as fast as we can so that we can vaccinate as many people as possible based on how many doses that we get.
So Nikki is joining us now from just inside Mount Sinai Hospital. Nikki, I don't know much about vaccines, but this seems like it needs to be treated with kid gloves, if you will. You know, you have all this extra stuff about keeping it cold. So how is Mount Sinai otherwise preparing to start these vaccinations?
Well, Anne-Marie, we're actually inside one of Mount Sinai's hospital in the atrium here. And the first step that they're doing is this is the area they actually usually use for flu shots, which they're turning into vaccine pods. They hope to be able to vaccinate about a dozen people at a time. They will also have an optional observation area where they will monitor people after they've received the vaccine for any severe reactions like we've seen in the UK. They have 2 freezers in this hospital, 9 across all their hospitals here in New York City. And the shelf life, which I had known, I asked Ms. Mashney, is 6 months. And like you noted, there's a tricky amount of time they have to play with to get the vaccine from a freezer into a patient. But they are ready, and they actually already have appointments here on Monday for some of their frontline workers to receive that Pfizer vaccine if it's approved. Anne-Marie?
Yeah, you know, just to talk about how sensitive this vaccine is, the dose has to be used within 6 hours of being taken out of the freezer. I think the freezer can only be opened twice for the day. I wonder if there is a concern that there may be a lot of vaccine that just simply goes to waste because they can't maintain the temperature.
I think no one really knows. Of course, all of these health systems are doing everything they can to prepare. Here at Mount Sinai, they have an army of people working on this. They've actually had to bring in people to help. There will be medical and pharmacy students nearby in the city and residents that are part of the Mount Sinai system actually here giving vaccines. So they've thought of every aspect to be able to address any issues with lines of people getting the vaccines in, and most importantly, that time, which is, you know, doing a lot of math in their head to get the vaccine from the freezer into the patient safely. And I think part of the reason they are making appointments here is so that they can time out when exactly they'll need the vaccine rather than just having people rush in randomly. Anne-Marie?
That will definitely happen. So is the general public going to be able to get a vaccine at the local hospital?
We were told here eventually, yes, they will, and Mount Sinai expects lines of people outside when that time comes, and they say they will do everything they can to get people the vaccines. They say they'll also work with local CVS, Walgreens to get people in there as well. They will take people here also by appointment and vaccinate as many people as they can when the vaccine is available to the general public. Anne-Marie?
So you mentioned in your story about the 2 individuals in the UK who had an allergic reaction to the vaccine. These are people who typically have severe allergic reactions. And so now the guidance in the UK is if you're one of those types of people, if you carry an EpiPen, maybe you shouldn't get this virus right now, rather get this vaccine right now. Do we know of any additional guidance on who should avoid getting the vaccine, at least in the early stages?
Yes, experts are saying that pregnant women, children under the age of 16, and transplant patients should avoid the vaccine for now until further research is done, because some of those groups of people haven't been a part of the trials and the studies. So hopefully eventually that might change, but for now, experts say they should avoid the vaccine, as well as people with, of course, severe reactions to vaccines. And people with food allergies, the guidance isn't for them to not take the shot entirely, but perhaps to be cautious. Anne-Marie?
All right, Nikki Battiste, thank you so much.